we also have time tomorrow afternoon during the think tank. So it's really try to only questions to what we have been presenting here. If it's for like an action plan for the stewards, it's for tomorrow.
I have a question for Dr. Leibbrandt. What do you call low foot problem? Because you talked about the horse which had 4 problems, including lower.
In the lower foot.
Lower foot problem. Yes.
Yes. So that means that the lower foot that is behind the fetlock joint, and there can be problems in there, which can be navicular disease. There can be osteoarthritis. So it's heel pain. So it can be several things.
Okay, thank you.
You're welcome.
You talk about navicular problems. Can they be induced by a wrong use of the horse, or are they just there anyway and they're going to be revealed by a wrong?
I think everything is possible. I'm convinced, but I think there is, if you really want to prove it, research should be done. But this is a difficult research, because then you should follow up 150 horses under the exact same circumstances, which is not possible. So we are really stuck in this field with, well, this is not evidence-based. No, because this research is not possible. But if you look at it from a biomechanical perspective, if the horse is landing incorrectly or loading the front leg too long, it gives a biomechanical overload, especially of this part. Also, sometimes the fetlock joint and the suspensory ligament. And what I find very interesting, because I'm actually sort of working in the opposite direction, I think I prove that low, deep and round training is not good for the horse, because I fix them by doing the opposite. So even horses with navicular disease. But it's not the only thing. We change the feet as well. Most of the time we try to have the horses barefoot, so we can once every week, or sometimes once every 2 weeks, we can change the balance. Well, maintain it. So we do more. We do the myofascial release, we do the training, we do the foot balance, we do the nutrition, the saddle, rider, the bit. So it's everything. But for me, the main thing is what I work on is the training and the hoof balance. And it's really surprising to see how much a body can heal itself from if you outline the spine and you get the correct biomechanics back. Sometimes I'm in my bed at night and I'm like, how did it happen? Because what I do is so simple. Did I have to study for 6 years? Well, I don't know.
Thank you very much, Karin. I think Shelby wants to add something. Yeah.
No, I'm up here. Okay.
I think you have a microphone. You can take.
Okay.
Yeah.
Well, it's for Karin too. Also, I was just wondering, with the horses that you showed the before and afters of, how often were your sessions with them? Like, how frequently were you working with them?
That depends on what I'm actually doing. These horses were all examples that I was working together with my colleague, and she used to be one of my students, but she was extremely gifted, so now we work together. So it depends a little bit on how severe the problems are. So most of the time I start with the myofascial release. And actually one of the horses had to learn how to walk again. So we had to walk him slowly because his movement pattern was so abnormal that the only thing we could do is balance him in walk and walk slowly until he sort of got... He had 5 problems actually. He also had a mild ataxia. So it really depends, but most of the time I do 2 treatments within 3 to 4 weeks, a myofascial release. And in severe cases, my trainer trains these horses 4 times a week. So they also have a lot of recovery time in between. And it depends on, because we want the owners to be involved, because I didn't have a very good experience if I rehabbed the horses myself, and after 3 months the owner got the horse into the trailer and got it home, and then there was no problem anymore. You need to involve the owner from the beginning, so they know that there is a problem. And you need to involve them as well. Their fascia system needs to work. They need to balance themselves. And with those extremely hypermobile, sensitive horses with multiple injuries, it comes down to every detail. But if we have a very gifted rider as an owner, of course, they start riding earlier in the rehabilitation process. And then sometimes they take the horses home and we help them at home, because that is more relaxing for the horses most of the time.
Thank you. Yeah, there's a question from the live stream, I think.
Where?
Yeah.
So the first question is, it's for Karin. What would you recommend for someone with a horse with a top line syndrome which goes into hyperflexion himself to lengthen his neck? Exercises, professional advice, and yeah.
Okay, so the question is if a horse wants to go in hyperflexion himself. Yeah, that's what I see more and more, and that has to do with hypermobility and also the raised skeleton, because the center of gravity is more going forward, and because of the hypermobility, we all learned that we have to make the horse more supple, but the hypermobility is getting more and more and more. So now my first goal is to stabilize the horse and then make it supple, because those hypermobile horses, they can compensate for everything. So this is what happens with this horse. The weight is too much forward. So if we lengthen the neck like that, he will fall forward even more. And he has in the horse, so this is a lever. And if he has to compensate in a correct way for the lever, he needs to shift the weight to the hindquarters. But those hypermobile horses, they don't know how to do it. And they really have to shift a lot, and they don't have the strength. So they don't have the technique and they don't have the strength. So therefore, they choose to go behind the vertical because that makes it easier for them, and they don't know that in time they will be in bigger problems. So what I do with these horses, first I check, is it possible for this horse to really lift the withers and really engage the thoracic sling? Then I train them without a rider, because if the horse cannot even lengthen the neck without a rider, if the horse needs to carry a rider, the thoracal part of the back will drop down and he has to shorten the neck. So as soon as the horse can move without a rider in a correct forward, downward, outward posture with ease, in relaxation, so that is the part where it starts to be boring. So when he shows like, la, 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 I can do this, then it's time to put a rider on the horse. But the rider needs to be skilled, needs to be balanced, needs to be moving together with the horse. And yeah, preferably light. So sometimes you need to ask a light rider to start and then a heavier rider.
Thank you very much, Karin. Sylvie, you had the question yourself, no? You can.
When you talk about extending a neck.
Yes.
Can you just get the microphone
Well,
better? Yeah.
My question is, what about the height of the head and the weight on the shoulders?
Yeah, so that's so your question is, if you extend the neck, what is the height of the head and what happens with the weight on the shoulders? Yeah. So the height of the head is more or less the eye on the level of the hip joint, more or less. If I go lower, so then it's more of a stretch. So if the horse is stretching the neck like he is eating grass, the back does lift, but the weight goes down. So we straighten the back instead of hollowing, but the weight goes to the forehand. So I do like the stretching, especially in the beginning, because if I have to retrain horses who have been trained low and round, they don't have confidence in the rider anymore, don't have confidence in the trainer, they don't have confidence in the bit. They don't dare to lengthen the neck because they have been told to stay behind the bit. So it takes me a lot of time to before they trust me and my hands enough to try another position, so it can be completely upwards or completely downwards. I don't care, because they try something else. So then when they stretch the neck, I'm happy, because this is also a sign of relaxation. But it doesn't engage the thoracic sling. So if the horse feels more confident, I start to tell them, no, don't lower that much. And I start to engage the thoracic sling. And when the thoracic sling is engaged, the horses... can you remember the last picture I showed of my presentation? So from the withers, the neck goes up and then into that direction. And then you get the weight to the hindquarters. But if the neck goes down, the weight goes to the forehand and the thoracic sling is not activated.
Thank you very much. Karin, I have a little question. When you're working with these horses who have no confidence anymore in the hands because of the bit that they have been taught to stay behind, would it be faster to get them in a correct frame again without a bit and just with a halter to get rid of this problem of this lack of confidence in the bit?
Yes, sometimes we do. Sometimes the horses are too sensitive in the mouth, so we train them without a bit. But I have to say that there is also a big difference between the temperament of the horses 20 years ago and now. Because together with the hypomobility, also the nervous system is very, very sharp. So sometimes I have to make a choice because you have more control over a horse when you are training them with a bit. So we teach the horses to take our hands. They are in control of the contact. But if something really goes wrong, we are in control. And that's for the safety of the rider and sometimes of the horse. Because I have really seen crazy things with horses that really cannot
control themselves
anymore. And this is getting a really big issue. And also one of the reasons why riders, even if they want to lengthen, they don't dare to lengthen anymore. And that's why I'm very happy with trainers like you, that you are working on confidence. But still, we have difficult cases that can take years before they start to stabilize. So yes, if it is possible, I work without a bit. Some horses never accept a bit again. Well, they do, but they stay a little bit chewy, and then they perform better on just a bitless bridle. And sometimes horses tend to lean too much on the bitless bridle. So then I prefer the bit again. So I don't have rules.
You adapt. Okay, thank you.
Yes, I took it very seriously when that professor said, use your common sense. test, try.
Okay, thank you very much. Are there any other questions? I just wanted to thank also Sarah for having pointed out the fact that we can teach a horse in LDR without anything on his head. It's really very easy. You can learn a horse going in LDR without anything on his head. So I thought it was important to point that out too. Thank you very much. So I think we're going to close because it's exactly 7 o'clock. Thank you very much for everyone. Thank you very much to the guest speakers, Patrick Gallou for the technical assistance, Danielle for the also technical assistance. Thank you very much.